Thank you, Kathy, and good afternoon, everybody. It's a beautiful day outside here in upstate New York. I hope it's nice where everyone is attending today. We've got a pretty full agenda for this afternoon. We're going to start off with Emily Iannuzzi. She's in our Garden City office, and Emily's going to talk about FEMA relief and some of the aspects associated with a program that I don't think has gotten as much attention as perhaps it needs. So Emily, take it away.
Thanks, Pete. Hi, everyone. I'm Emily Iannuzzi. Before I get started, I just want to give you a little warning that the Blue Angels are going to be doing a flyby in our area. So if you hear any fighter jets, don't be alarmed. There's nothing to worry about. It's kind of cool. So without further ado, I'm going to be giving you a brief overview of FEMA's public assistance program. The first thing you need to know is that back on March 20th, the president approved what's called a major disaster declaration for New York State. And as a result, eligible New York entities will be eligible for reimbursement of COVID-related costs through FEMA's public assistance program. And in New York, that program will be administered by the New York State Department of Homeland Security and Emergency Services. If you're eligible, you could be reimbursed for 100% of your costs. It's usually a 75% reimbursement, but for COVID-19, they just changed that to 100%. Next slide, please. Okay, so real quick, this is what they call the eligibility pyramid. I just want to point out that there are 4 tiers of eligibility, and in order to be eligible for reimbursement, you need to be eligible under each of these 4 tiers. So if we look at the next slide, the first tier is who are eligible applicants. There are 2 types of eligible applicants. On the one hand, you have your governmental entities, which is pretty self-explanatory. On the other hand, you have your private nonprofits, or PNPs, as I'll call them. There are 2 types of PNPs which are eligible. The first are PNPs that provide critical services, and those are your emergency medical care facilities, your educational facilities, whether it be primary or secondary level, or even higher ed institutions. In addition, other critical PNPs are going to be fire protection services and utility companies. The other type of PNP which is eligible is any PNP which provides non-critical but essential social services to the general public. So this is a non-exhaustive list of examples, but this would be places like community centers, homeless shelters, libraries, houses of worship, museums, zoos, performing arts centers, things of that nature. Okay, next slide, please. The second tier of eligibility is that you have to show you have an eligible facility. Applicants must own or operate a facility which has been affected by COVID-19 and which is the legal responsibility of the applicant. The facility has to be located in an area covered by the emergency, which in New York is the whole state. The facility must have been in use during the emergency. The emergency incident dates back to January 20th with respect to COVID-19. And the facility cannot be under the authority of some other federal agency like HHS, for example. Now, the Department of Homeland Security has noted that municipalities may not be able to point to a physical facility which has been affected by COVID-19. They've recognized that and said that for municipalities, you don't necessarily need to show that for COVID-19. Okay, next slide, please. Moving on to the third tier of eligibility, this is work. So depending on the disaster, there are different categories of work which may be reimbursable. For COVID-19, the only category we're talking about is emergency protective measures. So that's action that's taken to save lives or protect the public health and safety. So that could include emergency medical care, medical sheltering, providing food and water or other essential goods, or security for temporary facilities, things of that nature. So to be eligible, the work must be within that category of emergency protective measures, and the work must be required as a direct result of COVID-19. It also must be the legal responsibility of the applicant. The work must be located in a declared county, which again is the entire state. And the work must be completed within the regulatory time limits, which for COVID-19 is currently September 19th. However, the state can extend that by 6 months, and then subject to FEMA approval, it could be extended further beyond that. Okay, next slide, please. Okay, so if all of the bottom 3 tiers have been satisfied, you get to the tippy top of the pyramid, and this is, I'm guessing, what most people are interested in: what costs are going to be reimbursed. Before I give you specific examples of the types of costs which may be reimbursable and may not be, we have to go through the technical criteria for the types of costs which will be reimbursable. So the cost has to be reasonable and necessary to accomplish the emergency protective measures. The cost must be compliant with federal, state, and local procurement requirements. It's got to be reduced by any applicable credits. So let's say the cost is covered under some insurance policy, or you could recoup the cost under a private contract, or there's other funding available for the cost. You cannot double dip, essentially. And the cost finally must be at least $3,300 to be eligible. Just a quick note on that first factor, reasonable and necessary. If you, for example, purchase 10,000 face masks to prepare for your response to COVID-19, and you only wind up using and needing 1,000 of those face masks, you can submit a request for reimbursement for all 10,000, but you're not going to be reimbursed for all 10,000 because that clearly was not reasonable and necessary in light of the fact that you only wound up using 1,000. Okay, next slide, please. Okay, so before I go over the eligible types of costs that may be reimbursable, I want to just point out that unfortunately the following are not reimbursable. Many people have incurred substantial costs in transitioning to a remote workplace or setting up distance learning. Those types of costs are not going to be reimbursable. Similarly, any lost revenue or income or donations, those are not going to be reimbursable. Legal fees, we strongly encourage you to consult with counsel throughout this constantly evolving situation, but be advised that those costs will not be reimbursable under this program. And finally, any costs covered through some other source, including insurance policies or some other federal agency, those are not going to be reimbursable. Again, you cannot double dip. Okay, moving on to the next slide, please. These are the costs which you could get reimbursed for. Certain labor costs. So for example, if you have permanent employees who you've had to call in on overtime to perform emergency protective measures, those overtime expenses could be reimbursable. Likewise, if you've had to hire temporary staff to come in to perform emergency protective measures, those costs could be reimbursable. Similarly, any equipment such as PPE that you've had to purchase or that you've used from your own inventory that you would not have used but for COVID-19, those could be reimbursable. Cleaning services. So a lot of places have already had to hire cleaning services to disinfect the workforce after someone contracts COVID-19. Those costs could be reimbursable. And I won't go through every single thing on the list, but security for temporary facilities could be reimbursable. Any costs incurred in getting set up for virus testing, those could be reimbursable. But I want to skip to the note at the bottom, document everything. I cannot stress this enough. In their presentations, the Department of Homeland Security and Emergency Services has really stressed that you need to be able to prove the expenses incurred and not just that, but show how they were the direct result of COVID-19. So for example, if you have someone coming in to perform overtime, having your payroll records and timesheets may not be enough. You need to point to what those people were doing on overtime and how that related to the response to COVID-19. So other types of things which you may want to keep to prove the cost basically would be your records of materials taken from inventory or records of materials that you've had to purchase, information if you've had equipment used to transport essential goods. You might want to keep logs of your equipment usage. Any records of contracts, any records showing that you complied with the procurement requirements, invoices, checks, things of this nature. You really need to document everything you could possibly think of. If you don't have sufficient documentation, then that could prohibit you from getting reimbursed. So if we go to the next slide, this is the final slide. If you think you have some costs which are reimbursable, you would basically apply through the FEMA's grants portal. If you have an account in the grants portal from a prior emergency, you would simply log on and submit your request for public assistance. If you do not already have an account, then you could go to FEMA's website and set one up. Or if you would like assistance in doing so, you can reach out to the New York State Department of Homeland Security and Emergency Services, and they can help you get set up with an account so that you can submit your request for public assistance. So that's my overview. I know it's a lot of information, but I hope it was helpful. And Pete, were there any questions?
There were, and I think, frankly, they anticipated much of your presentation. It seemed like we'd have a question and then you'd answer it. So I think we're pretty well coordinated. Next, I'd like to go to Rod McDonald. In addition to the FEMA update, we wanted to give you an update on the payroll protection program. The CARES Act amendments, CARES Act 2, if you will. And so, Rod, if you're ready, take it away. Rod, I think you're muted. Hang on. Let's get you on. There you go. Thank you.
Is that better?
That is.
Okay. Thank you. Been struggling with technical difficulties this morning here. Yeah. So as everyone knows, back in the last week of March, the CARES Act was signed into law, provided $349 billion in funding for the Paycheck Protection Program, and those funds were exhausted in about 2 weeks. So last week, the Paycheck Protection Program and Healthcare Enhancement Act was signed into law. This added added $310 billion more funding for the PPP, $60 billion to be set aside for loans from small banks, credit unions, and community financial institutions. But I think the biggest news about the PPP 2 round is that the program faced a very public backlash after revelations that public companies and big companies had obtained loans. So last week, the SBA issued new guidance regarding the required certification when a borrower makes an application for a PPP loan. And the new guidance said that all borrowers must assess their economic need for the loan, a PPP loan, at the time of the loan application. And the guidance from the SBA pointed out that while the CARES Act suspended the ordinary SBA requirements that a borrower must not be able to obtain credit elsewhere, that even under the PPP, the borrower must still certify in good faith that the loan request is necessary. And the certification in the application is that the current economic uncertainty makes this loan request necessary to support the ongoing operations of the applicant. So the guidance that came out last week, the SBA unpacked that a little bit more and said that the borrowers must make the certification in good faith, taking into account their current business activity and their ability to access other sources of liquidity sufficient to support their ongoing operations in a manner that is not significantly detrimental to their business. And the SBA went on to say it's unlikely a public company with a substantial market value and access to capital markets could make that certification in good faith. The guidance from the SBA created a safe harbor. They if you're a borrower and you applied before this guidance came out, and you repay the loan in full by May 7th, we will deem that you made the certification in good faith. So this morning, the Treasury Secretary upped the ante a little bit. He said, he told CNBC that the SBA will audit any company borrowing more than $2 million. And he said he'd be putting out an announcement this morning. I haven't seen that yet, but he said that the SBA will be doing a full review of loans in excess of $2 million before there is loan forgiveness. And the Treasury Secretary also said that borrowers may face criminal liability if they made the certification and quote, "it's not true." And he specifically identified the Los Angeles Lakers, who have apparently since returned the money that they received. And he said that they would have had liability had they not returned the money. So clearly the stakes have risen. I think I remember hearing from clients, a few weeks ago, my accountant said it's free money. Everyone should just be applying for this. After adverse publicity, that's no longer the case. And the SBA is telling every borrower, you need to look at your certification and look at your other sources of liquidity. And can you say in good faith that you need this? So our recommendation for borrowers that are faced with this and they're trying to determine whether they can make the certification in good faith is to run sort of with and without pro forma projections. What would it look like if you didn't take the loan? How else would you have? And what would it look like with the loan? And how many jobs would you save? So this is developing. As I said, there's supposed to be another announcement from Treasury or the SBA at some point today about this new standard that they're going to be auditing any borrowing over $2 million and looking at that before they determine whether the loan is suitable for forgiveness. So Pete, that's really the latest on the PPP program.
Thanks, Rod. Appreciate that. So a couple different flavors of relief that may be available, and obviously a lot going on with the PPP program at this point. So we'll need to keep an eye on that, and everybody who has applied or is looking at the new monies that are available needs to monitor that carefully. Let's go now to Hermes Fernandez. Hermes is a member in our Albany office, and he'll be the first of two presentations that we do this morning on some reopening considerations. Hermes, take it away. Again, Hermes, I think you're muted. Let's get you unmuted and start over.
Unmuted. There we go.
There we go.
All right. Too anxious to start. Well, thank you, Peter. As Pete said, I'm one of two presentations regarding going from New York Pause to New York Forward. I'm going to discuss what has been going on from the government side, the preparation to move from Pause to Forward. Katie Schaefer, who's going to follow me, will talk about what you can be doing to prepare. We can go to the next slide, please. If I were better at preparing slides, this slide that says May 15th would have either been in gray or it'd be fading out, or maybe I'd have it go from dark to light, or maybe there'd just be fireworks, or maybe there'd be just this, the May 15th. May 15th actually suited my my capabilities preparing slides. May 15th.
I like the bullet though. I mean, it is a very attractive graphic.
Thanks, Pete. I worked on that. That took some doing. I had to find center instead of left adjust on there. In any event, May 15th is central to all of our discussions, and yet is also somewhat distant from our discussions. Today's April 28th. There's 17 days to May 15th, which in terms of this pandemic is a long time. May 15th is the date in which the governor's executive orders that have placed New York on pause begin to expire, right? The stay-at-home order expires on May 15th. We expect, because the governor has said that he will be extending this May 15th date. But how it's extended and where it's extended is really the questions of the day. As I said, it's 17 days until May 15th. We really don't know, and I believe the governor doesn't know at this point what he will do as May 15th approaches. I know as I go through and I spend all my non-spare time now simply reading about COVID-19, when I'm looking at government directives coming either from the CDC or from the State Department of Health or from other government agencies, if I see something that now has a March date on it, I must get past it because that is so long ago in these terms. And I'm saying this as an attorney, who we look up cases and cite them to clients from the 40s and from the turn of the century, from the turn of the 19th century. 20 days away, 20 days past, 20 days in the future at this point seems like eternities. We don't know where we'll be. Next slide. We pulled this slide from the New York Times because it shows more dramatically than anything I've seen where we are and what we are doing. I shouldn't say more dramatically than anything I've seen. The pictures of Hart Island that showed the mass graves that have occurred in New York City is the most dramatic. This graph shows why we are talking today and where we've been. This is a graph of what is normal expected rates of death in New York City. And you'll see that the numbers are very faint, but what you see is a squiggly line that is basically flat, basically a straight line. And this goes back from 2017 to approximately today, right? And deaths by week in New York City run about 1,000 a week during normal times. And this includes flu outbreaks, right? This includes flu outbreaks. But this graph shows that in our period of time right now, April of 2020, there have been 20,000 deaths more than would have been expected if we were simply facing current times. This is, this is New York City. It's not Long Island or Westchester, Rockland, where the numbers have also been extreme. It's not upstate, we recognize that, but this shows where we are coming from. And this is the driver, right? This is the driver of what government is looking at in terms of how we will come out of this, what we're looking to avoid, right? We've heard the term flattening the curve time and time and time again, right? Well, this doesn't even show a curve, right? This is just an absolute spike. It's a spear into the top of the graph. Let's go to the next slide. There we go. Now this slide comes straight from the State Department of Health's website. It's updated on a daily basis. And what you can see here, looking from the metropolitan area, which is kind of a dark, I don't know what color that is, a darkish red, right? Going up the state, going up the Hudson, what you can see here, and this still goes to, and I've got a point of showing you these things. This basically shows what we're seeing in terms of the spread of the disease, the spread of COVID-19 throughout the state. And what's noticeable is, I think, three things. First, obviously, is the focus in the New York City metropolitan area. But secondly, what you see is, and I can't point to this for you, but if you look at the right-hand side of the map of the state, you'll see the darker colors, right? There are still darker colors going right along the Hudson River. They go past Albany County, even going up into Warren County, Washington County, right? Up to the Lake George area, right? Showing kind of a spread here from New York City straight up the Hudson. Really the headwaters of the Hudson in Warren County, and that's you can see darker colors. You go towards the western part of the state, and then you see some pockets, right? You see Onondaga County, a darker color, but not the darkest color, not even one of the darkest colors. Monroe County, darker color, and Erie County, the darkest. Erie County has seen more than any other area in upstate New York. There have been over 200 deaths in Erie County, right, which pales in comparison to the city, but 200 deaths is an extraordinary number. Let's go to the next slide. Next slide, please. What we've heard from the governor, and the governor's words have changed. They've changed over time, and they've changed to a certain extent in the last week by day in terms of what the governor is talking about in terms of opening the state of New York on May 15th or after. The governor's talked about looking at the state by regions, and the governor's been very focused on regions. He's talked about the Northeast region. He's tried to coordinate with governors from New Jersey, Pennsylvania, Delaware, Rhode Island, Connecticut, right? So he's looked at a Northeastern region, but he's also beginning to look at the state as a region. And when the governor shut the state down, right, the governor insisted this was one state, he had to deal with it as one state. But in terms of reopening, the governor's begun talking about reopening by regions. These regions come from a map that also comes from one of the governor's press briefings. These regions match what has been used by the governor for economic grants. He said, look, we can't talk about counties, we can't talk about cities, we have to talk about areas where people live. And he's talked about when he opens the state after May 15th, it will be on a regional basis with the clear expectation that New York City, Long Island, Westchester, Rockland counties will be trailers because of the high numbers that they've had there. We, I think, upstate have had some benefit in that the fact that the governor closed the state when he did, I could be wrong on this, but my view is that probably prevented the spread of the disease upstate, right? We have, when we look at the testing data now, and let's go to the next slide, we've seen that in the testing that's been done, the sampling that's been done, only 3% of the upstate population is projected to actually carry the COVID-19 antibodies, which is a suggestion only a little more than 3% of the population upstate has had COVID-19. The numbers downstate go to as high as over 21% in Manhattan. So the governor has looked at reopening, and there's been some pieces now that he's undertaken, right, with the cooperation of the health department and others on a basis. Some of these things relate by regions, some of them don't. That's why we're not quite sure where he's going yet, why I think he's not quite sure where he's going. But what we saw at the end of last week is the governor organized through the state health department a testing survey, right? They went out, the health department sent testers out, people were being stopped at big box stores, at grocery stores, being asked to allow themselves to be tested for COVID-19 with a finger prick. They did what they believed to be was a appropriately sampled test, did over 2,000 people, and that's where they came up with these numbers that suggest the percentages that I just mentioned, about 3% upstate, as high as over 21% Manhattan, and very high numbers in the New York metro area. Higher numbers in Erie County, I believe, as well. I think it was like a 7% positive rate in the Erie County area. That was all in preparation for reopening the state. It was an attempt to identify, what do we have? What do we know we have? So what's the first steps that we've seen taken beyond the testing is, and this is supposed to be happening today, the governor announced hospitals would be allowed to begin to undertake elective surgeries again. This is before May 15th, right? That's today, we're in the end of April. This is a big deal, right? And this is, I think, a leading indicator of what we're going to see. Now, this isn't just about healthcare, right? The fact that the governor is recognizing that elective surgeries can begin again is some indication of a belief that other aspects of the state can move forward in a different way and more positively. But what we're also seeing is while the governor has been talking on a daily basis about these regions, which I showed you in the previous slide, when it came to hospitals, what the governor has done is actually on a county by county basis. And he's announced essentially that in New York, where we have 59 counties, I believe, or it depends on how you count New York City, which is 5 counties. Elective surgery will take place in most counties of the state, But there's some surprises here, right? It's not in Westchester, not in Rockland, not Long Island or New York City, but Yates County, Schuyler County, also included in the list of not being allowed to have elective surgeries, right? So what does that suggest? It suggests something other than a regional approach. It suggests a very narrow approach, looking at what are the particulars in those areas. For the elective surgeries, what they're asking, what the governor is talking about, what the Commissioner of Health is talking about is hospital capacity. But hospital capacity is being looked at as what is the status in that locale? What's the expectation that there will be excess hospital beds if there is a breakout of COVID-19, or is there already a breakout of COVID-19? And that's going to tie to the next slide and the slides thereafter. The other things the governor has done now to begin the process of reopening the state, all in anticipation of this May 15th date, is 2 days ago, the governor authorized pharmacists to begin administering COVID-19 testing. And yesterday, the State Department of Health put out a directive that is very specific and was a fulfillment of a governor's executive order from a few days before, where the department has rejiggered the listing of who is eligible for tests. We've heard over and over again, right, that there have not been sufficient numbers of tests available. And we were starting with the only people who could be tested were people who were showing symptoms. The list now, it's a 3-page guidance document that doesn't look very dissimilar from what we've seen from the Empire State Development Corporation regarding what businesses are essential, what businesses are not. There's a long list of who is eligible now to be tested, and breaking it down to, in easily digested pieces. Healthcare workers. If you're a healthcare worker, you can now be tested. If you are an essential worker with direct public interaction, and this term public is a term that I've been scratching my head about ever since they started using it in the governor's executive orders. I take it to mean if you're an essential worker with direct public interaction, that would clearly means if you were a grocery store worker, you're going to have public interaction. If you are a salesperson, you're going to have direct public interaction. If you are a factory worker working with other factory workers in a closed space, I don't think that is public interaction, but remains to be seen. But this is very significant, because the question of making testing available goes along with how do we judge how the state is doing. Let's go to the next slide. And where the state can open and when the state may close. So the governor's talked about a regional, as I mentioned, a regional analysis. This is a slide that we simply took from the governor's press briefings on, I believe this was Friday, when the governor put this out. This is a 10-point test that the governor has used. First piece of this is the most important. A region can reopen, or the governor will move towards reopening a region when there's been a 14-day decline, right? And that 14 days is one of these numbers that we're seeing at the national level, we're seeing at the state level, right? We're seeing people just in shock that state of Texas is reopening after only a 2-day decline. State of Georgia didn't wait for any decline. Other states, right, governors are very much saying 14 days. We hear at the federal level, Dr. Birx and Dr. Fauci talking about 14 days. You need to see a 14-day decline in new cases, not new hospitalizations, not deaths, but new cases. Apart from that, we look at industries. The governor's mentioned specifically construction and manufacturing to be opening first, but that's not blanket. It may be blanket for construction because they've taken some steps in that direction. Manufacturing, though, may vary. What business precautions will be in place? Katie's going to talk about that. Healthcare capacity comes back to what I was talking about just regarding elective surgeries. What is the capacity of the system? Can the healthcare system in the particular region being opened, is it going to have space in the ICUs? Since we're talking about this being a long-term problem, at least through next year, what about flu season? Our supply stockpile, we saw what happened 2 months ago, beginning in March through April, when there weren't sufficient supplies. A testing regimen. The testing regimen I just laid out, the governor's starting that process. Tracing, right? There's actually a 4-part process for tracing, right? We go to identification, testing, tracing, which happens with local health departments, right? And then isolation. Isolation facilities. The governor's actually talking about actually finding spaces. Not sending people home, but sending people, if not to hospitals, to hotels or other places where they can be kept safely. Regional coordination, schools, businesses, right? The governor talks about those two things together. You can't open businesses if you can't open schools. You can't open schools if you can't open businesses. 9, no attractive nuisances. Forget crowds. We're not going to any festivals. Movie theaters are coming last. I don't know when we're going to watch a football game in person again. Concerts, all those things. Amusement parks. Apparently the governor doesn't like golf because golf courses are open, so that's not considered an attractive nuisance. It's just a nuisance. So those are open. And then we go regional control room. Let's go to our last slide. Or I guess our next to last slide. We've seen this before. This is a graph of the balance, right? If you're more essential, maybe you open earlier, even though the risk is higher. If you're less essential and high risk, you're opening last. Now let's go to our last slide. The reopening. This comes straight from one of the governor's press briefings. He used this today. I think he might have used it yesterday. He might have used it on Sunday as well. These are this is just a graphic, a visualization of the things the governor's looking at. Once you reopen, are you going to stay open? So what happens? Do the hospitalization rates go up? Do the testing rates show there's a spread of the disease? Are the infection rates changing, right? Is the disease becoming more contagious or less contagious? It's a virus. Viruses mutate very, very quickly. Its ability to infect can change. Governor's going to be looking at all those things. The health department will follow those very closely. And the fact that we reopen doesn't mean we will stay reopening, but we'll see these things happen. If we were to go back to that initial map, you've looked at the lighter colors. It certainly looks like if you're in a county that's in a light color, you're more likely to open. The darker the colors remain, and like where I am in Albany, the numbers are still going up. I wouldn't expect Albany to open as quickly as I would expect the Syracuse area to open. New York being last, Erie County somewhere in between. So with that, Pete, I'm done. We can turn over to Katie. Thank you.
Thanks, Hermes. Just a quick program note here. We have a lot of content today. We're going to run over. Hopefully you can stay with us past 12:45 because we've got 2 more presentations. Katie's going to talk about some different aspects of reopening, and then we're going to have Dave Farrar give us some tips on avoiding discrimination claims. So if you can spare 10 to 15 more minutes beyond our scheduled time, please do. And with that, Katie, take it away.
Thanks, Pete. So as Hermes pointed out, over the weekend, we got some new information from the governor and some more specifics about his plan to unpause New York. Well, we expect to get more guidance and more clarity as time goes on and we approach these potential reopening dates. We know that in order for employers to reopen, they will need to have a plan in place specific to their unique workforce and their unique workplace. And so it'll be important for employers to take this time now to proactively plan for what the new normal will look like so that you're ready to reopen when the time comes. Next slide, please, Kathy. So right now, the governor anticipates reopening in phases, perhaps on a regional basis, with phase 1 being the construction and manufacturing businesses with low risk, and phase 2 being other businesses looking to reopen based on this matrix they've come up with. And we know that the matrix is based on 2 kind of sliding scales, 1 being how essential your business is, and 2 being how low or high the infection risk is in your workplace. And we know that there may not be too much you can do to change how essential you are given the nature of your business, but you can take action to move toward a lower risk of infection. So bumping yourself up potentially from the red to the yellow category or the yellow to the green category on this matrix and potentially giving you a chance to reopen sooner. Next slide, please, Kathy. So a couple things are apparent at this point anyways. The governor wants businesses to come forward with their own plans on how to reduce the risk of transmission in the workplace in order to reopen. And that includes even those in the construction and manufacturing businesses in phase 1. They're going to have to show that they're low risk. Another thing that's apparent is that the precautions we take now to lower the risk infection in the workplace, it's going to put yourself in the best position to open earlier. And for the most part, this is going to be a pretty significant undertaking for most businesses. We cannot expect to simply open the doors and return to work under the same conditions as they existed pre-pandemic. The plan that you put in place is going to be employer specific and very fact dependent. Businesses are going to need to identify those aspects of their operation that present risks from transmission and figure out how to help ameliorate those risks. And the plans are going to have to address, your people, your employees and your customers, your places, the physical aspects and the access to your workplace, as well as your processes, so things like training and communication. Next slide, please, Kathy. So we've identified 4 components you'll need to address as part of your reopening plan. And the first is a workplace safety. And this is very dynamic. There's CDC and OSHA guidance out there, and it's going to depend on your own workplace setups. But this is the part of a plan that's going to include things like sanitization, social distancing, engineering controls, PPE, employee health screenings, and monitoring. All those different things related to your workplace are going to go into a workplace safety plan. A proactive infection plan is really how you're going to respond to positive cases, employees showing symptoms or being in close contact with someone with a positive case, and how are you going to manage those potential return to work. The employee relations piece is really anticipating those labor and employment issues likely to result as a part of any reopening. So reviewing existing attendance and leave policies to see if they strike the right balance between encouraging people to stay home if they're sick and encouraging people to come to work so you have adequate staffing. Compliance with new state and federal laws regarding COVID-19 leave, so the paid sick and the expansion of paid sick leave and the expansion of the FMLA. Making sure you're collecting that appropriate documentation for tax credits and return to work issues. Those are just some of the things that are going to go into our employee relations part of the plan. And the last component is the one I want to take a minute to focus in on in a little more depth here, the communication and training. Next slide, please, Kathy. So it may be easy to overlook these considerations when we're trying to wrap our heads around PPE and social distancing and temperature checks and all these things that we never thought we would be doing or have to think about in our workplace. But communication and training will be critically important to the success of the other pieces of your plan. So you can have the most detailed and well thought out safety and infection plans in place, but if your employees aren't aware of them and your supervisors don't know how to enforce them and how to respond to incidents when they arise, then those plans aren't going to be of much use to you. And it's also important to note that the governor has called out communication and training as something specifically identified as needing to be part of your reopening plan. So it's another reason you're going to want to make sure you're thinking about these things now. And in thinking about communication and training on reopening, one of the first considerations you'll have is how to reach your workforce. Gone are the days where you can gather a large group in a conference room and tell them all about these new plans you put in place and new protocols. So you're going to have to think of other ways to reach your workforce. Maybe that's emails or webinars or video conferencing. And this is especially true if you've got a significant percentage of the workforce that's teleworking or it's furloughed right now. And I think ideally, you want to designate an individual or maybe a committee to be responsible for the communication, for its implementation, and for review to see how effective it's been. Have there been gaps in the communication that need to be updated? One of the most important pieces of the communication is the return to work communication. And this is something that should be done prior to employees returning to work, explaining to them the new measures and protocols you've put in place to help keep them safe and healthy. And this is important for a number of reasons. One, a lot of workers are going to be anxious about returning to the workplace and what that means for them. And so they're going to know what measures you put in place to help keep them safe and to reduce the risk of transmission. It's also important that you do this prior to them returning to work because you want to make sure that these protocols are followed on day one. You don't want your folks arriving and having everyone congregating in an area and not being aware that you're going to be doing temperature checks or certain screenings. You want to make sure that all the hard work you put into these safety and infection protocols is followed from the get-go. And the other piece of why this is important is that you want to make sure your employees know that you're following the guidance out there, you're following the executive orders, and you're complying with what they need to be complying with. We're aware of the AG, the Attorney General, and the DOL getting thousands of complaints from workers from businesses that are operating right now, indicating they don't feel the businesses are operating in a safe manner. So being kind of transparent about these measures and showing that you're taking this seriously may help you actually avoid receiving one of those complaints. So basically what you're doing in this communication is you're taking those components from the other parts of your plan, the workplace safety, your proactive infection, and you're pulling out those pieces that employees are going to need to know before they return to work. So in addition to, when they're returning, how you're going to be scaling up operations, this will be any changes in the physical workplace, physical adaptations, social distancing measures regarding the workplace, any changes in the physical layout, any closing of conferencing rooms or break rooms, staggering of shifts, any recommendations for alternatives in commuting to work, new sanitation and cleaning measures, information on any screenings and temperature checks that may be subjected to. Additional hygiene protocols are going to be expected to follow, information on PPE and face coverings and when they may be required to wear them, when and how they can acquire them, and what to do if they experience symptoms of COVID-19. So all those pieces and more are going to be in that communication to your employees. Another piece of this that I don't think can be overlooked is training, especially for your supervisors and managers. It's going to be critical to ensure the consistent compliance with and the enforcement of your workplace safety and proactive infection control plans. So training should include things like information on these new policies and procedures you put in place, new employee leave policies perhaps, but it should also include things like how supervisors are expected to monitor, report non-compliance and successes with the protocols, how they're expected to respond to employee concerns, how they're expected to respond to suspected cases of COVID-19. And I think it really should be encouraging supervisors to be proactive and checking in with their employees and also reporting back to you if there's any gaps in those communications or things that aren't translating to the workforce and how we can fix that. Workplace signage is another thing that may be helpful to you. Consider if there's signage or posters you can put in your workplace to remind employees of things like hand washing and social distancing measures or any PPE requirements. It can be an easy way to kind of remind employees of those protocols. And in addition to your employees, you'll also want to think about what other groups of people frequent your workplace? Do you have customers or clients, contractors, vendors, and visitors? Do they normally come to your work site? You've likely implemented new rules for accessing the work site, and you'll have to change perhaps maybe the hours or availability. Maybe you've done that. So you'll have to think about how you're going to communicate those changes to these other groups of people. Maybe it's posting notices on your website. Maybe it's workplace signage. Maybe it's direct communication to certain people. But that should be a part of this plan as well. Your response to positive COVID-19 cases. So in your proactive infection plan, you've thought about how you're going to respond to these cases in the workplace. And I think it makes sense to have those communications ready to go regarding these incidents so that you can respond quickly and appropriately instead of being caught behind the 8 ball trying to draft the communication after an incident happens. You should be taking review of these as you go along. So not just before they return to work, but as you go along, if there's gaps in the communication, if there's things that need to be updated, problems that arise, keep reassessing this and keep thinking about how to get those messaging to your employees. So providing those periodic reminders and important updates. And lastly, maintaining copies of these communications is going to be really important. The general rule is if it's not documented, it didn't happen, right? So make sure you're keeping copies of these to show all the good work that you've been doing. And I know I threw a lot at you there, but this is certainly not going to be the last time we talk about this topic. We have a number of attorneys that practice in different areas here, staying up to date on reopening and what employers will need to do to put a plan in place to help guide you through that process. So this will certainly not be the last time we talk about it. Pete?
Katie, good points. A lot of content, as you say. And I think, in my view, people are well advised to start thinking about this now. As Hermes points out, it is evolving. The thinking on it's evolving, and we don't have all the guidance, and we don't know exactly how it's going to be rolled out. But I think we've got enough clues to get started here and start working on these plans and figuring out where the gap areas are, so that we can then fill those. You may need to enlist some consultants. You hopefully will be talking to us to analyze your risks. A lot of it's going to be the gumshoe work of analyzing your own workplaces and trying to figure out how to mitigate the risks. But getting started now is, I think, a very good idea. Let's turn to David Ferrara. David's a partner in our Syracuse office, and David's got some thoughts on avoiding employment discrimination claims. Dave, take it away.
Well, thanks, Pete. And I sure wish I was with you in person because I quite frankly, I miss being with our clients, and we appreciate your loyalty through this period. Katie did a fantastic job on reminder number 1 for me, and that is educating your workforce regarding the special issues related to COVID-19. I won't repeat what I was going to say, but I would just add a couple other points. There is a tremendous amount of guidance available, and I think to most of us, it's overwhelming. Here's a couple that I think are excellent in helping you educate your workforce and make the changes to your workforce that probably make sense to minimize your exposure. OSHA has put out a series of guidance that talks about not only infection prevention, but engineering controls. I think they're excellent, whether it's barriers, ventilators, temporary lunchrooms. I think they've done a real nice job with that, as well as their PPE and personal hygiene protocols. The White House, as you may know, last week issued its guidance. I think there's some very good suggestions there as well. And finally, here in New York, the state executive order dealing with employees wearing masks if they're coming into contact with customers or other members of the public. So there's a wealth of information. I think they are 3 very good areas where you will be able to acquire some invaluable information on educating your workforce regarding the special issues related to COVID-19. Now, my second reminder is harassment claims, unfortunately, based on race and national origin, directed at different employees. Primarily, we expect those that have tested positive or presumptive positive probably warrant special attention from you. For those of you that recall, the 9/11 reaction to the Muslim community hopefully does not get repeated. But when politicians are making comments about the Chinese flu or the Wuhan initiative, obviously it doesn't help you send messages to your employees that that type of behavior simply violates our policy. So I'm recommending, and we're recommending, a top-down communication as part of, to Katie's point, preparing for the return of the workforce. A very, very strong worded top-down communication that makes it clear, that reminds people that that type of behavior or those type of harassing comments or those cartoons in the men's room or the ladies' room are absolutely not going to be tolerated and will subject employees to the company's normal harassment non-discrimination policy. Number 3, don't overlook the potential whistleblower claims under both OSHA and local Department of Labor. As Katie mentioned, we've seen a rise in complaints to the AG's office, but we've also, just yesterday, there was a lawsuit filed by a general counsel, quite frankly, against her employer for $1 million because she alleged that the employer required her to return to her office in violation of a stay-at-home order. So I do think we're going to see a lot of litigation in this area. And that we need to be particularly careful that you've not only done all that great work preparing your workplace, establishing the protocols and the various preventative measures that Katie talked about, but now you got to make sure you're complying with them and that employees are complying with them. So please don't overlook that point. My next point is, and I appreciate you staying with us, is there's going to be a need for reasonable accommodations under both New York human rights law and most likely the ADA. Even though folks that have been conflicted with the virus most likely only have a temporary disability, I think you're going to find yourself in situations where you're going to have to deploy the interactive process to at least assess whether or not an accommodation can be made. For example, I mentioned the governor's order requiring employees to wear masks when they interact with customers or other members of the public. There's also guidance that says we are not, as employers, allowed to ask the employee for documentation that involves personal confidential information to substantiate their refusal to wear those masks. Now that puts you as an employer in a very difficult position. For the time being, until we get better guidance, I think I would ask that and suggest you deploy the interactive process to assess whether or not he or she can continue to work in a different area, on a different shift where they may not be exposed to those customers or members of the general public. But to simply say, put the mask on or go home, I think you open the door, unfortunately, to some potential claims of discrimination. Number 5, document the objective basis for employees returning to work from layoff. Now, we could spend a lot of time here, right? A number of employers are going to right-size their business in connection with bringing people back to work. We know that's going to happen. And as a result, some people most likely are not going to be recalled. Or if they're recalled, they're going to be recalled later on in the process. So when and how you open your facility in terms of the return of your workforce clearly creates significant legal risks if preventative planning is not undertaken. I would think under Title VII, workers' compensation, potential OSHA claims, and potential Department of Health closure orders if you're not careful on how you're bringing folks back. So we think it's very essential that you're not going to remember 2 years from now when I'm preparing you for a deposition, geez, why did I make that decision not to bring her back? Or why did I bring these few people back? So assess the circumstances you made the decision, identify positions who might be eligible still for teleworking, but for those that you bring back, ensure that you've got documented reasons why and how you made your decisions so that it's memorialized. And remember, you probably have to make special accommodations for older workers and those who have serious underlying health conditions. If there's a consideration for based on that, again, you need to make sure we've documented it and we can defend it later on, because in some cases it may not be defensible. Okay. Next, and Katie hit on this, so I'll be very quick here. You not only have to train supervisors and managers, obviously, before it's too late, but on two different bases. We have to train them as to be on the alert for harassing, discriminating behavior. And I heard it on TV is not a defense. And the supervisor and manager, of course, who participates, that conduct is imputed to you as the employer. So this, I think, is a very critical point, as Katie mentioned, prior to anyone returning to the building, making sure our supervisors understand the added responsibility we are asking them to carry out, because, as I said, the fact that some politicians said it on TV, that's going to be no defense. The other aspect we need to make sure supervisors and managers are trained on is your protocols and prevention methods that you've employed to make sure you're creating the safest workplace you can. It's of no value if you go through all that effort, implement the protocols, implement the engineering control changes, implement various social distancing policies, and then not have supervisors and managers ensure that they're being followed. Lastly, and I'll leave you with this one, of course, we should be looking at our discrimination/harassment policies to update them so that, you know, we're being tasked more and more to provide specific examples in those policies. The general statements of discriminations prohibited based on all the protected classes is long gone and is, quite frankly, blatantly deficient. We need to have examples in these policies specifically geared toward certain unlawful issues. We would recommend that you look at those policies, get guidance so that you can beef those up and make sure we're addressing issues related to COVID-19. Thank you. Stay healthy. Pete, turn it back to you.
David, thank you. And thank you for everybody for staying on. I'm looking at the numbers here on my screen, and it's remarkable the number of people who stayed over with us. I think it's a tribute to how important and difficult these topics are. So if we made you late for your 1 o'clock meeting, we apologize. We're trying to get you as much content as possible. The slides will be available on our coronavirus webpage tomorrow around noon. Thanks everybody for hanging in with us, being our clients and our friends, and everybody stay safe. We'll talk soon.